Welcome, everybody, to our Facebook Live. I am here with Dr. Ajay Kumar. He's a Chief Clinical Officer of Hartford Healthcare, and we are here to answer your questions about the coronavirus. And welcome, Doctor. Thank you so much for sharing your time with us. I know it's a very busy time at Hartford Healthcare, and we should let our listeners and viewers know that something has rapidly changed in the last 20 minutes or so since we ended the noon news, and that the World Health Organization has declared the coronavirus a pandemic.
That's right.
What does that mean, really?
So pandemic is generally defined as with multiple continents or countries have a infection which is spreading rapidly. This is actually a lot more serious than endemic, which was classified before. It has implication. It has implication, obviously, how we react to that and how we see the disease, the way it is spreading. So I think this is an interesting times we're living in right now.
Yeah, well, and I just watched what the World Health Organization was putting out, just to give some characterization, that in the past 2 weeks, the number of cases outside China has increased 13-fold. The number of affected countries has tripled. There are now more than 118,000 cases in 114 countries, and 4,291 people have died. So the idea is not to instill panic, but I think as lives here in America have started to drastically change, even in the last 48 hours, where people are very upset about sporting tournaments being canceled and schools possibly being canceled, elementary schools getting rid of, science fairs and choir concerts. Why is it so important, from your perspective, that these containment measures exist?
This is a great question. So just level set, in the United States, we have more than 1,000 cases right now, and obviously we're seeing increased number of mortality across the country and across the world at the moment. The containment effort are really important because our primary measure to stop the spread of the disease is to reduce the contact or the spread of the disease. So the large gatherings, large meetings, or travels and things like that, where it's easy for people to get exposed. Look, this virus is interesting. This is a new virus we've detected, and we are still learning about it, but it is easily contractable through airborne, through physical contact.
So you just said airborne. People were thinking, oh, it's not airborne. Has that changed, or we just weren't aware that it was airborne?
Well, it is, because if I'm sitting right next to you less than 6 feet, and if I was to have a sneeze or cough, I could easily transfer this virus to you.
Okay.
So that is a concern here. When I say airborne, it's not an entire room, but the close proximity I'm talking about. And that is the concern we have. So limiting anything what we do where the large number of people are segregated, where one person can infect multiple people, and it's a kind of a rapid wildfire. If you have one person infecting 20 can go and infect another 400. So it multiplies like that. So containment effort helps contain this process.
So for the people who are saying this is hype, stop it, more people get the flu, more people die from the flu is more serious, how do you answer that?
Well, it's not a hype. Let me start with that. The flu has been in existence for a long time. We have several different types of virus which are living in our surroundings, so which we have learned to have immunity, or we have some treatment options, or we have vaccines. This is a newly found virus which jumped from animal to human beings back in December sometime. And what we are finding is that we don't actually have any immunity to this, and we don't have any cure at the moment. And
if you have it, there's no treatment, right? You might get Tamiflu for flu, or something. We have no treatment.
There is no treatment at this time, and vaccines are in early stages of development. It'll take more than a year by the time we have a vaccine. So that's a concern, because this actually has a higher mortality rate. A lot of sick people, especially the elderly people with a chronic kidney disease, chronic lung disease, immunosuppressed, people whose immune system is compromised, they are at a higher risk of death with this disease.
So we've gotten some questions from our viewers, and I'm going to be looking as you post your questions on the Facebook Live. Please share this with your friends. If you have those who have questions, we will be taking them from the Facebook Live. But let me start out with some of you who've already sent them in. Karine asked, if people can be asymptomatic and still spread the disease as reported, how is it considered to be spread by a droplet? As a nurse, this sounds more like airborne transmission, which would be a whole lot more concerning. You just said it actually is. Yeah. We should think of it as airborne.
Yeah, we should be careful at this time, because large gathering you can actually easily spread. I think your question, what you're asking, is that people are asymptomatic. Could they transfer that? That's a real concern. A lot of patients actually a lot of young individuals are going to have this disease, which is going to be asymptomatic, and so I would not know if I were exposed to this virus. I may not display any symptoms, but I could easily pass somebody who's sitting next to me who's has a higher risk, as I described earlier on, and pass the disease.
So thankfully, children seem to be doing very well. But if I am understanding you correctly, why we maybe want to cancel the school play is that the child could have be a carrier, and grandma who's at risk could get it from the child.
I think you got it exactly right. And it's children's actually who can easily be carrier and spread to a lot of different people, and that's a concern we have. And they may not have any symptoms. And we don't understand at this time why children don't have a sick disease, which is a good thing, but they don't actually have a very serious disease at the moment.
Which is different from the flu, where you usually see a U-curve of the elderly and the very young getting it, and people in the middle are better. We're not seeing that. The children are, thankfully, they're doing quite well.
You're very well informed. I'm impressed. Yeah, and you're right about this, exactly. And I think we're still learning about this virus. That's why it's called novel coronavirus or COVID-19. That's different names have been used. Because it's brand new in our system, and
we just don't know.
Yeah, we just don't know at the moment. We're still learning.
People have said it's already mutated, and is that true? And what does that mean if it has mutated?
Yeah, so there are two strains have been detected. One is more virulent, and other one is a little less. One actually can cause significant problem. What we saw in China, one of the most virulent one caused a lot of mortality. So there has been two strains detected at this time.
Okay.
And the
so
concern
it might depend on which strain you're getting, not just your own immune system.
Yeah, it does actually. Which strain actually affects you can lead to higher risk or lower risk. Now, we don't know at the moment where we are in the spectrum of the percentage-wise, which one is more. But in China, at least what we learned, the significant, the risky or the virulent strain caused more mortality.
Okay. Shelley's asking, if worst case and someone does end up with a breathing aid, does the virus run its course and the lungs rejuvenate with the patient returning to being healthy? If not, what is the prognosis?
Generally, there is a supportive treatment. It depends on the underlying capability or the underlying medical conditions the patient has. What we do is we provide supportive care, the oxygen therapy and supportive care with the ventilation help and other things. Generally, the people who recover, they recover completely, and there's no remnant effect as best we know. But again, I want to remind the viewers, it's a early stages of learning we are in at this time, so we don't know the long-term effect of this, what that would look like.
So, and I'm just getting some, I'm having some other people write in and ask questions. Is this like the flu? When we talk about these social distancing, people think, okay, so what happens if we do this now? If we perhaps end up canceling schools, as we're seeing lots of universities start to do today, if we cancel major events like sporting events, and then it goes away, but then we all start to circulate again, what happens? Does it just die out like the flu, or we don't know?
Well, this virus is most likely not going to die out forever. It is most likely going to linger in our society and going to come back in winter again. And that's why it's important for us to get the research ready for the vaccines and other modalities, because it's going to happen again at some point. The severity of that and how the impact is going to be, the immunity we're going to create is somewhat unknown at the moment. It's early stages to kind of comment on that.
So we've got someone else is asking a question. P.S. It's 50 and over that's considered old and at risk. This virus is not that old, so people pay attention. There has been some confusion about that. I have heard 60, I have heard 50. Who's most at risk?
Generally, CDC has talked about 65 and above at this time, but at the same time, if you're younger and you're diabetic, you have a chronic kidney disease, you have a lung disease, you have a heart disease, you're at higher risk, because a lot of patients actually find a respiratory compromise or issue compromise with the lung and breathing capacity. So they're at a higher risk.
So, and also today, the United States had a new level where I want to clear up, because some of our Facebook watchers are saying, oh, 1,000 deaths, that's not accurate. That wasn't it. We have 1,000 cases now in the United States. Is that correct?
That is right.
More
yeah.
than, maybe
more than 1,000 cases, yeah.
Would you say we have many more cases than we're aware of just because we haven't been able to test people?
That's right. Actually, we've had some shortage in supply of the kits, and we've not been able to test all of them. Look, CDC started putting the guidelines out to test individuals coming from level 3 and level 2 countries. Quite frankly, I think more than likely we have a lot more people infected. We're testing less at the moment.
Another question, how long after symptoms pass are people still contagious?
It's been a quite a debate in the medical community what that would be like. There's really no firm answer we know at the moment. We think that people who get exposed within 2 days, they become contagious to infect other people, and it could run the course all the way up to 28 to 30 days. Now, if I'm infected, generally they say that somewhere between 8 to 14 days, 8 to 10 days, I would be fine and I would not pass the virus. So the numbers are all over the place at the moment. I would consider 14 days as a safe time if you're exposed, and 14 days is a safe time. But if you're symptomatic and you're admitted in the hospital, we don't know at the moment.
We don't know how many days after your symptoms go away.
That's right.
If you're the 14-day self-quarantines right now are because you're waiting to see if you have symptoms.
That's right. Waiting to do, because you are still contagious. If you're infected, you're contagious for at least 12 days. Maybe I can take a step back and explain. If I get exposed right now and I'm asymptomatic, or I have a very mild symptom, the best thing to do, take rest at home, drink plenty of water, and make sure you call for help if things change or the symptoms worse. Within 14 days, we see most people recovering and getting better. Within 8 to 12 days, we think that the contagious period has gone away. Okay. So after 14 days, they can come back to the community.
Okay. How long does the virus live on hard or soft surfaces? Does a regular hot wash cycle and detergent kill coronavirus on your bed linen?
I don't know whether I know the answer for this one, I must admit. Generally, the virus lives anywhere from 8 to 10 days on the hot surface.
8 to 10 days. So that's the issue, is that if someone sneezed on this table, you're saying 8 days later it could be there.
It could very well be. And so you using alcohol-based rubs and are the best thing. I don't know how to wash the linen at the moment.
I mean, well, let me ask you. I know you said you're very prepared at Hartford Healthcare. Obviously, there are lots of linens. How are you? What can we learn from you of how you're sanitizing the hospitals?
Yeah, thank you. So, look, hospitals generally follow a very rigorous process of sanitizing and sterilization, so we have a very well-defined process. Hartford Healthcare has not seen a single case. I just want to remind viewers, we have not had a positive case. We've been well prepared. We started preparation back in January, and we've done a lot of wonderful things to prevent this happening in the organization. So our system, the way it works, the cleaning and the process of sterilization is very good. And also, there was a question which was asked earlier on when I was coming back here, should I cancel my surgery if I have a surgery scheduled tomorrow? We don't advise that. At least in Hartford Healthcare, we've been very careful. We have an excellent system, our education process, our process of rolling out the screening tools and a method of isolation, our capabilities within the system of negative pressure rooms. We have full-scale operation. We don't recommend anybody to cancel any surgeries at this time.
So are masks going to work against catching the virus, yes or no? I think what the person is asking, there's been a lot of people who want to wear these masks. And everything I've heard from officials is that the masks are not helping unless perhaps you are dealing with sick people and they want masks on the sick people. What's the final word at this moment anyway
That's
on
right.
masks?
Yeah, I'm glad you asked this question. Even Surgeon General, who was at Hartford, actually, Hartford Healthcare, he made an announcement, please don't wear masks. So there are only some specific types of masks called N95, which needs a individualized fit testing. These are the right type of mask which would work. And we advise the masks to be used when you're taking care of somebody who's exposed or already has an infection. We don't advise any regular mask to be wearing by anybody. In fact, they can cause more problems because you have something, you touch your face more and you have the zone of viruses living right next to you. So we advise not to wear the mask at this time.
Parents are really concerned about how they might be disrupted if schools close. I know some things have been coming out from different school districts saying how they would possibly close schools, online learning. What is your thought on a need to close schools? Yeah,
it's an interesting question. So as you probably have heard, most of the universities and many of the schools are actually taking precautionary measures. And I think these precautionary measures are really well thought out, well done. If there is a capability within the school systems or the educational institution to be able to create a distance learning, create a virtual classrooms, that is going to help our society to stop the spread of this disease. It does have a social consequence, obviously. The kids or the children who are at home, it has a downstream effect of how you manage it, how do you kind of organize your life around that. But these are the challenging times we're living in. We have to wrestle this out as best we can. I would advise any social distancing strategy, which might include some closures or reducing the number of exposure, any place for the exposure to happen. Our school system in Connecticut, I believe, is watching it very carefully. I have a lot of trust in that. The individuals are really keeping a good eye on that. And I'll take the direction from those school authorities. They've been connected with the DPH. I've been in the rooms and discussing about how to manage that that process. I would rely on their guidance at this time.
Mm-hmm. So for parents, would you advise workers right now, if they're working in businesses, some businesses like ours, it would be very difficult to work from home.
Yeah.
But is the advice now that if companies do have the ability to have their employees work from home, even if there's not a case, do we need to social distance and work from home before there's a known case in the office?
Yeah, so, I can give an example of Hartford Healthcare. We've taken multiple steps right now in social distancing strategies and looking into reducing the exposure to our healthcare workers. So we were one of the earlier ones, I believe, in Connecticut, where we instituted a travel policy, travel ban. So all non-essential travels to international destinations or even domestic destinations, we stopped. We also discouraged any personal travels people are planning to take in the next few weeks. We also have come up with a social distancing strategy. We've reduced the number of meetings we have. We have reduced the number of gatherings we have at this time, and we're doing as much as possible through virtually. In fact, we are making sure anybody who comes to interview within our organization, as you know, we're a big employer, we hire a lot of people every single year. We screen everybody, and we're trying to reduce the number of people who are physically coming to our organization, and we are trying to use different technology to interview them. Mm-hmm. We're working with the vendors, the contractors, the volunteers. So we've looked into all possible zone of possible exposure in Hartford Healthcare and reduce the capability of transmission to a healthcare worker. And we believe, at least I believe strongly, the healthcare workers needs to be prepared better at this time, because what is to come, we should be there for the community's sake at that time.
So for the people who are joining the feed, and there's a lot still out there saying, what is going on? Why are we doing this? More people die of the flu. What I understand is that we're looking at what happened in China, and they're kind of coming out the other end.
Yeah.
If we don't contain this, what's the fear? Why is it so important that we take these disruptive measures?
Yeah, so comparing to the death because of flu and less death is never a good answer. We should try to eliminate any death possible from wherever it's possible. The risk we have right now, because we don't have a cure, we don't have an immunity within our society to face this virus, and the infectivity or the contagiousness is quite startling at the moment.
It's extremely contagious.
It is very contagious, and it's spreading really fast, as we have seen how the speed of the spread has been in different parts of the world.
Way more contagious than the flu?
It's a difficult question to answer. It seems that way at this time. And if you see some of the countries which are struggling right now, the hospital systems are crippling down, and our capabilities to be able to care for people who really already having challenging times in the healthcare journey is going to be crippled. And we wouldn't want to be in the place. We don't want to be in the place where we are trying to figure this out. How do you manage the overburdened hospital system, the healthcare system?
Even within our own country, right? We've seen that perhaps things could have been done better out on the West Coast. And is that part of it, that we're trying to avoid having that level of crisis?
Yeah, so, I wouldn't be able to comment exactly what they could have done better, but there's learning lessons out there. The learning lessons is increased testing. Increased testing really helps. In some parts of the world, we've seen the testing has been done a lot more, like Germany and other places. The containment strategy, the social distancing strategy, some of the places have actually done very well, and some places have not doing very well. So I think we're learning from a lot of different epicenters of this disease right now. We have a capability and, quite frankly, a little time at our hand right now to get ahead of that at this time.
Some are asking about travel.
Yeah.
People have cruises booked. I've heard, at least from spring break, this specific question is, we have a cruise booked for the summer. Do we cancel that?
So it's an interesting question. I would not give a direct advice on that for a variety of reasons. But if I was the one who was taking a cruise at the moment, I would cancel it. Mm-hmm. If I was traveling, I would cancel it. I will try to avoid all hot zones and all those things. But at the same time, summer is a little far away. I just want to make sure people understand we're watching this week by week. And I think if you have a cruise booked in summer, August or July, I think I would wait it until May and see where we are right now and how to manage that part here. The things will change over time, and it's difficult to predict at this time.
Someone else from Facebook, Dawn, has asked, the understandable focus has been on the elderly and those with underlying conditions. But how concerned should we be about those who are healthy, who may end up being carriers of the virus and passing it on to vulnerable demographics? Some reporting makes it sound that if you're young, you shouldn't be concerned. It's no big deal.
Everybody should be concerned, whether you're young or old, because you can contract this virus and carry it and give it to your loved ones. And I think the younger ones, especially, who may not display any symptoms and unknowingly might transmit to somebody, the loved ones actually, who are at higher risk of death. So I think everybody should be concerned.
Another is asking, what's in this virus that's killing people? And are there extra steps that we can take to help elderly parents or young children? Just to be clear, some have asked that it is true that young children are not getting this as often as other people. That's something you've confirmed. Yeah.
So what's new in this virus is that this is an animal virus, and it has spilled over to the human population. So we really are learning, and this is a new virus we're seeing in our society, which is circulating right now. So we have a lot of unknowns. So we don't have treatment options and vaccines and any other immunity built into our system. Now, what precautions even elderly or young can take is washing your hands 20 seconds on the sink with a nice soap and alcohol sanitizer. Clean your hands and make sure you create you make sure you stay clean. Elbow bump is a great idea. I advise people to avoid hugging or shaking hands at this time. I would also add that social distancing, we talked about it earlier on, but that's a critical thing at the moment to think about. Large gatherings, large meetings, in your workplace as well, you can avoid that. Try to convert a lot of things into virtual times at the moment.
A lot of people are asking, how long will this last? I know it's a crystal ball question.
Yeah.
Could you tell us what matters? How will this be affected?
If I was a betting man, which I'm not, I would see that we are yet to see the peak in Connecticut. We have not seen the peak. We are going to see increased cases. We are going to see increased number of disease at this time. And I think late April is a time I'm anticipating the way the other geographical areas have been behaving and working. And based on our preparedness, especially the healthcare system in Connecticut and the Hartford Healthcare and other systems, I'm hoping that we are going to be able to, containment will not be complete, but at least will be a lot better than other places. So I'm hoping after April things will be different, but I don't have a crystal ball.
Let's talk about the testing. We have a story coming up later on Eyewitness News about drive-through testing. When people hear that at first, they said, is this a scam? Because we've also been warning people about coronavirus scams.
Yeah.
Drive-through testing is real.
Yeah, it's not a scam, actually. So, in Hartford Healthcare, I piloted and a few times now some of the members who can just drive up to the place and get testing done and go home. And these are the individuals who fit in the CDC criteria, who have exposure to the high-risk areas, and obviously they don't have symptoms, but they are healthcare workers, so they might actually expose somebody else and cause issues. Individuals who've tested with minor symptoms as well. And it's a test at the moment. The reason is we want to be able to create a scenario where the testing can happen away from the healthcare facility, so not expose multiple people, and convenient to the folks actually who wants to get testing done, and at the same time not expose the healthcare workers to a larger number of people who may be sick. And those individuals we think who can be sent home with some rest at home, who are mildly symptomatic and things like that. So we've tested this out. We have the structure and infrastructure in place to roll that out quickly. The challenge we have right now, the testing kits availability.
That's still a problem, and that's one of the reasons why the governor declared a health emergency, is to get more testing. Not that it's already a crisis here, but to get out ahead of it. So people have certainly asked, I don't know, I'm not feeling well. How do I know if I need to be tested? Or if you really aren't feeling well and you have some of these symptoms, how do you get tested?
So right now the testing, and it's changing rapidly. So right now the testing is available in the hospitals, EDs and other places where you can go and get the testing done. DPH had put out a statement that some of the centers, the primary care centers, can also do testing. I'm not quite familiar with that, which areas can or cannot do at the moment. I advise the members of the community to call our hotline. We have a 24/7 hotline in Hartford Healthcare. We started several days ago, and we thought it was a need for the community to be able to get right information. There's a lot of fake information out there. So we have 10 individuals, 24/7, infectious disease doctors, internal medicine doctors, nurses, the true clinicians of the Hartford Healthcare who are actually screening every single call and advising patients or the community members what to do. And we've taken more than 1,000 calls in a very short time, and we're getting calls from actually all over the country. We've got 13 states beyond Connecticut calling us.
Can you share that hotline number?
Yeah, it's 860-972-8100. 860-972-8100.
And I know that the state has also asked people to call 211 if they just have questions.
Yes, 211 is the other site as well. But mind you, our hotline is staffed by clinicians 24 hours. And there's a real experts, the infectious disease experts, who are taking calls of the patients at this time.
So the other question that Missy is asking, do symptoms come on gradually like a cold or rapidly like a flu?
So generally, about 80 to 90% of the patients would have a fever. About 60-something% patients would have a cough or shortness of breath at that time. It's always it's like a flu illness. You start feeling one day runny nose and having a low-grade fever or feeling just not well, and rapidly in the course of the day, you will find yourself having fevers and other things. But as you know, there's a spectrum. We talked about some patients are completely asymptomatic and some people requiring intensive level care.
And that's the confusion thing. So what would you tell someone who is having a fever? Because I've heard from the symptoms, right? It's aches, it's body, it's cold, sneeze, flu-like symptoms. And our immunologist that came on had said that you really can't distinguish unless you test.
Yeah, so that's a challenge we have. So let me try to explain from a different way. The flu is still happening in the state of Connecticut. We're seeing declining, but the flu is still out there.
Okay.
The common cold is still out there. So generally, most people, common things are common. Most people actually who have not had a risk exposure to high-risk place or have not been in contact with somebody who's COVID-19 positive, more than likely it's a common cold. That's the kind of rationale. So I wouldn't want community to panic or worry about that. Number two, if you do have symptoms, and with some of the risk factors we just talked about, do call us and try to get some advice. If you feel when you make a decision, when do I need to go to the hospital, that depends on what you will do if you have a really bad flu, if you're unable to take care of yourself, if you don't have support system around you, if you're feeling shortness of breath, if you're feeling that you're just unable to manage yourself at home, call for help at that time.
What makes the coronavirus deadly? How do people die from it?
It's generally the respiratory failure. The lungs are unable to manage the demand of the oxygen of the body, simply put. It does affect the lungs and creates what we call as a significant reaction, which leads to the problem. The second issue is when individuals have this viral infection, they get secondary infection. So most patients, or a lot of patients actually will get secondary bacterial infection, which gets difficult to control.
And just if you joined the feed late, I want to repeat what you said is the difference, because people say, oh, come on, people have the flu, people have cancer, the flu has been around, and you do actually have some treatments for it. Yeah. As of right now, there are no treatments for coronavirus.
There's no treatment for coronavirus.
No, you can't use Tamiflu, you can't use anything. It's just about monitoring and maybe giving IVs or fluids and that kind of thing. No treatment. A lot of people are asking about the weather. It's going to be getting warm around here. Will the warmer weather help stop the virus?
You know, I actually don't know the answer, to be honest with you. I mean, this has been a debate for a while. We've seen some of those coronavirus spread in the warmer countries as well. So the behavior has been somewhat unpredictable at the moment. So I wouldn't count on that at the moment, but that's a hope.
Someone asked, my daughters are 6 and 7. They have asthma. Should I stop sending them to school?
I would not take an action like that unless the school advises you. And I can tell you at least state of Connecticut school system is doing a really good job in advising the parents appropriately. As I said, the kids actually generally don't get a significant disease. If the asthma is well controlled and schools are open, I would send them to school.
Someone's asking about a mosquito bite. Like, is it like Zika? Can it be, if a mosquito bite were to get infected, is that a way for coronavirus to enter? I guess the question that, if I could group a few of these, we keep saying wash our hands and not touch people.
Yeah.
Can the virus get through your skin, or if you have a cut?
No, it would not. If you wash your hands for 20 seconds very well, and if you use alcohol-based sanitizers, you should be able to reduce or eliminate the risk of getting the virus. Mosquito bite will not transmit this. However, we are still learning and we still don't know all the modes of transmission. So recently we find that this virus can be transmitted what we call the fecal-oral route. So somebody has gone to toilet and have not washed their hands appropriately. Somebody who actually has infected, there is a possibility you can transfer through that source as well.
Okay. So the main advice right now is still hand washing, but there's a lot of, as I watch the Facebook, there's a lot of fear, which has its own problem. If we get into panic, if we get into full-blown fear, that has its own level of risk. Fear actually compromises immune systems, right? So there's anxiety and all that out there. But if you can tell people, what's the balanced way? What's the middle way here to observe these containment efforts, because they're important for the rest of everybody else, and not get too afraid? Yeah,
so, I think this is not the time to panic. This is the time to prepare and be aware and be educated. So I'll start with that. I think I want to reassure, at least in Connecticut, our healthcare system has done a good job in preparing ourselves. Hartford Healthcare and other systems, I think, have been really preparing themselves very well. So we live in a community. We're blessed to have some excellent systems to support our needs in the organization here. The precautions one needs to take is obviously, I would add hand hygiene is very important, obviously. Touching the face, you can avoid that especially when you're out and about, you're touching the surfaces which may or may not be clean, and you touch them with your face, then it can cause some challenges. Social distancing, I will stress that again, to think about that. How do you reduce the risk of being in areas where unfamiliar area where you could be infected? So if, for example, if I was to go to Broadway show in New York, I'll be concerned over there.
You've told your own employees that they are not to travel to New York, and that's something very common for people here in Connecticut to go into New York City.
We are strongly advising our colleagues across the Hartford Healthcare not to expose themselves in the risky places.
So no Broadway shows. If it's even around here on the weekends, people are thinking, okay, should I go to the casino? Can I go to a sporting event?
I'm not entirely sure the industry which I'm talking about is going to like me after this comment here. However, I think it's a use your judgment at this time, and I would advise you not to be in surroundings where you could be exposed to somebody who may be traveling from a different part of the country and bringing the disease and passing it on. Mm-hmm. And so make a judgment call at this time. As I said, in Hartford Healthcare, we've been very quite clear about that. Even disciplining ourselves not to have large gatherings, large meetings.
Large gatherings are defined by the CDC of 100 or more, right? That's why we're seeing, but people are wondering what happened in the last couple of days. Why are they canceling everything? New guidelines from the CDC came out asking people to limit any gathering of more than 100 people. Is that correct?
Yeah, so, I think I'm not entirely sure there's a magic number out there. From Hartford Healthcare, we're looking at 20. Any gathering of 20 and more.
So you're doing 20 or more at the
20
hospital?
20 and more. Now, the only exceptions we're making for critical service, which is required for the patient. So we want to make sure the patients actually get the care for. So when we have a safety huddle, and there are the types of individuals actually who are critical for patient care. And frankly, at this time, my colleague, Chief Operating Officer Mike Dagley, or myself are giving permissions for those happening across the Hartford Healthcare. So we're that strict about that.
So I have a question from someone who says, my soaps don't say antibacterial. Will they still work? This is not a bacteria, right?
Yeah, this is a virus. 20 seconds washing your hands with water and soap is a good thing. And I want to make sure...
Even if it doesn't say antibacterial, the soap is going to work?
Soap is going to work, and I would advise you, when you wash your hands, not just this, make sure you cover all the nooks and crannies of the hands and wash for 20 seconds.
Does it matter if the water's warm or not?
It's personal preference. I don't know whether I have an answer for that.
Okay, because some people ask, does it have to be warm? And we're in places sometimes where it's difficult to wash your hands.
Yeah.
Or, with kids at school, I know there's a big concern about making your kids have good hygiene. Or someone asked a question, what about, either children or adults who have special needs and
Yeah.
they're not so great at taking care of themselves and they're going to these group homes? Or how do you help take care of a population that doesn't always listen to the hygiene part?
I'll advise you to carry some antiseptic wipes, alcohol-based wipes or lotions. I think that's the best way to protect yourself at this time, and make sure you wash your hands frequently.
What about mass transit, trains, boats, or Ubers and taxis?
It's an interesting question. I would advise against cruise, if I may, actually. Let's start from
The
there.
immunologist on Monday said absolutely no cruises.
Exactly. Thank you for somebody's backing me up. That's a good thing. I like to believe our airline industry is doing a good job in cleaning and making sure that things are done very well. But if you're elderly, if you're sick, and if you've got some underlying conditions, I would avoid at this time and use it for essential businesses. I wouldn't want to advise that everybody needs to be housebound at this time, but be cautious about that. Make sure you wash your hands frequently. Clean the surface where you're sitting next to you, and take precautions such as that.
Yesterday, there was a news report that the White House nixed a guideline that the CDC wanted, that elderly people should not fly on airplanes, or people who are immunocompromised should not fly on airplanes, and that apparently that was something the CDC wanted, but the White House nixed that for the general public. As a healthcare provider, do you have any advice about that 60 and over population flying on airplanes?
Well, if you're a high risk individual and you're going through a high risk zone, I would advise you not to fly at this time.
And so high risk is?
High risk is personally, if you've got chronic lung disease, chronic kidney disease, you've got a chronic lung, you have stroke, you're diabetic, you're immunocompromised, you're taking cancer medications or medications for things like rheumatoid arthritis and things like that, which can suppress your immune system, so you're high likelihood of getting a severe disease.
Asthma?
Asthma is not, actually. Asthma is
Okay.
okay because of the reactive situation, and I think asthma is okay. And so that's one way of describing a demographic of an individual who's high risk. The other way of describing the demographic of the location you're going high risk is CDC's website where the hotspots or the disease is prevalent.
But the problem is you don't know if you're going to an airport who's there.
And
right?
that's a challenge we have, because the airports is a wonderful meeting place for a lot of different types of travelers from different parts of the world, and you don't know who's from where. And that's, if you have to take an essential trip at that time, I would advise you to clean your hands and use alcohol-based sanitizers.
Do you think this is going to escalate in the next several days and weeks? Is this an ever-changing situation?
We are keeping an eye, actually more than a day, every day, and sometimes several times a day at this time. The situation is evolving so far. And I can just advise you how seriously we're taking it. At the Hartford Healthcare, we have an incident command center right now, which is in live 24/7. We are monitoring the activity in Connecticut, outside Connecticut, within our healthcare system, other healthcare systems, and globally at this time. And we're making sure that we stay ahead of that as much as possible.
What do you do if you work in a big office? Or what do you do if you work in a school, they say, and have a lung issue? I mean, at this point, if these were your patients, would you advise those people to say, I just can't work right now, or go about your daily life?
Yeah, I would not advise them not go work.
Or work from home.
But there are different types of industries. So if you have if there's a capability to be able to work from home and manage the productivity you expect you to have, I think I would advise you to do so. The folks like you and I who have to come to the work and workplace to be able to take care of the patients or be in the media interview place, we should be able to go about in a regular day as long as we take the precautions as we have just talked about.
What about gyms, like the YMCA or places that have indoor pools? We all want to take good care of ourselves. We want to exercise. Any thoughts?
Clean the surface when you're using. Most gyms have antiseptic wipes. Use those surface. I do not want to send a message to the public to not live your life at this time. This is not what's happening at this time. But use precautions. Be careful who you get exposed to and how you get exposed to, especially if we talked about the traveling and other high-risk areas. That would be my advice.
Mm-hmm. On a scale of 1 to 10, because we have people all over the spectrum, right? Of I'm in full-blown panic, or this is ridiculous, the media is hyping it. On a scale of 1 to 10, how serious do you want people to take this?
I want people to be educated. I want people to know what is going on and not call it a hype. It is not a hype. I'll be very clear on that. The second part is that I would not want people to be panicked, especially living in Connecticut, because I do want to assure that our system has worked very well, and we have not seen the peak we could have seen in this place here. So we are responding very well. We're prepared, at least in the healthcare system, we're prepared very well. Testing kits could be better, but generally we're prepared. I want people to be cautious at this time and to use a common sense judgment at times here, but not panic. I'm not panicked. I have a controlled concern. That's how I put it at this time.
Controlled concern. As we go throughout the next couple days, there are only 2 confirmed cases of people who live in Connecticut. There were 2 other healthcare workers that live in New York but had worked in Connecticut healthcare facilities, so that would bring a total of 4. But if you were to predict, now that the World Health Organization has just labeled this a pandemic within the last couple hours, what kinds of numbers are you preparing for?
It's very difficult to predict, but I can tell you the numbers are going to go high where we are right now.
Hundreds, thousands? I
hope not thousands. I hope it's in hundreds only, or less than 100. I think the work we've been doing, Hartford Healthcare, I go back to that as an example here. 30,000 employee, to be able to create a travel ban and to be able to create a social distancing policy, to be able to create a call center, to be able to make sure our supplies are intact, to make sure that everybody's educated what needs to be done. We have a screening policies and procedures in place. That is the kind of preparation we need, and I think we've been able to do that very well. And I think that preparation really helps. One, allow us to provide the care we are here to provide, and we are continue to operate normally, and that's a wonderful thing we can do. So I think our preparation is going to hopefully protect us from what could have been a worse scenario.
The immunologist who was on Monday, that was the first time we had someone from the healthcare community really come out and say, we're not doing enough. We need to cancel parades. We need to have more social distancing. Do you think we still need even more social distancing than what we're experiencing at the moment?
I think I would agree with the immunologist who came on Monday. We have done more so in the last 24 hours than we've done before, and I think we could do more at this time. I heard the parade got canceled, St. Patrick's Day's parade got canceled. That's a wonderful thing in my opinion. I think there are other social gatherings and other things which could be happening, the games. I think we need to think hard how we're doing it.
Yeah, the NCAA has said for basketball as of a moment they'll play. And I know the big issue in the news today that a lot of high school kids are holding rallies and protesting saying, let us play at these state tournaments.
Yeah.
They want to play without spectators. Do you still think that's a risk?
Without spectators should be okay. Look, I don't want to send a message to the people that we need to stop living our lives at this time here. But whatever we can do to reduce the risk at this time, the parade is a big risk. Large gatherings or large symposiums or meetings is a big risk at the moment here. But the games where kids are playing and the spectators are not in the seats, I think seems like a safe option to me.
So we'll have to see what the CIAC says. They had canceled all state tournaments just because they are following CDC guidelines. I don't know how many kids would be there if you had a state tournament, but that's something that they're saying, let us play, we'll do it without the fans. You would say that for March Madness, the basketball game should go on without fans.
I would say that's my opinion. I think where we are in Connecticut and how we're managing the situation with the appropriate hand sanitizing, making sure everybody who comes to the arena is screened for symptoms and any travel history. We need to do a better job of preventing it and protecting our kids at this time.
Should we expect school closures?
I don't know, actually. I think we can.
Mm-hmm. I mean, I know the meetings have been that we were talking about perhaps even 10 days at a time.
Yeah.
Is the advice that they're going to wait until a child in a school has actually been exposed, or would there be preventive school closings?
So my comments is either going to make kids happy or mom's very angry. At this time, I would say that school closure would happen only when we have a significant risk for exposing our kids at this time. Fortunately, we haven't seen any cases in the schools at this time. But again, as we test more, we will learn more, and we haven't tested enough. So that's the unknown we're living with right now.
Okay. Anything else? I know we've been on Facebook Live for a while now, and we thank the hundreds of people who have been joining us and asking questions. I think that we've asked pretty much all of them. If you want to look back at the video, you're going to be able to see that the doctor did answer some questions earlier on if you jumped on later about who's compromised and what about carriers. And to sum up, what you're saying is absolutely, if we're not symptomatic, we are still carriers, and that's the danger to give it to the people.
We could be carriers, yeah. Look, I would advise you a few things in summary here. One is this is not the time to panic. It's still time to prepare and continue to make sure you take care of yourself. Social distancing, and there's a lot of guidelines out there in CDC. It's on Hartford Healthcare website. You have a fair amount of information what you can do to protect yourself at this time. If you have concern, call our hotline 860-972-8100. You can enroll in a text messaging system through Hartford Healthcare as well. If you go on the website, you'll have the information, and we will send you alerts to the community of any new development happening in the country, in our community. I would be careful about that wrong information or fake news, as people call it. Want to make sure that you have the right source to get the information. CDC is a great website. I think that our state government has done a good job of the ct.gov. Hartford Healthcare website is putting a real-time information about what is happening, how we're protecting, what new things we're learning at this time. So make sure your sources of information is good. Education is hugely important. And obviously cleaning your hands, making sure you take the right precautions, hand sanitizers and 20 seconds of washing, avoiding large gatherings, to be aware of where there's activity happening and more so. And if it's essential, then you take all the precautions. If it's not essential, don't travel and stop.
So a vacation is not essential.
It's very personal. I have no idea how to answer this one, actually.
Well, I'm only asking you because people have real decisions to make. So I would like you to answer it from the perspective of a healthcare provider.
So if it was my family who was traveling right now to Europe, I would say I will cancel my trip. If my family was traveling to New York or California, I will cancel the trip. If I have a family member who already has an underlying medical disease, I would be very cautious in traveling any place at this time.
And if you have domestic travel set to not one of those places, a lot of people are going to Florida for spring break, a shorter flight, does that make a difference?
I would advise you to take extreme precautions of washing your hands, making sure you don't touch your hands and things like that, and make sure you don't have an underlying disease because it could be significant.
It bears repeating before we close out this Facebook Live that this is a lethal virus. Yep. You've said that we don't know a lot about. It's already mutated, and it's extremely contagious.
That's right, and it has a high mortality rate. A lot of people, we've seen mortality up to 3%, and the numbers are different in different regions. But in China, we've seen up to 3% deaths. Some other parts of the world, a little less than that.
What do you mean?
Up to 3%.
3%. Yes,
yeah.
up to 3%.
Yeah.
And so 3% compared to how deadly the flu is.
If I remember correctly, it's less than 1%, as 0.5.
So this is something that's why all these measures are coming out right
now.
Right. I saw one analogy. I was interviewing another doctor, and the doctor said, if we have botulism that's found in some canned goods, we still recall all of them, even though it's an inconvenient, because anything we can do to prevent sickness or death is the obligation of public health officials. So when people are looking at these containment procedures and saying, this is crazy, we have to live our lives, this is a matter of public health from your perspective. That's why these
exactly. This is a matter of public health. I think in society we're responsible to each other, and as we think about this disease, which is spreading rapidly, we don't have immunity, we don't have vaccines, we don't have treatment, cure at the moment. I think society needs to take precautions to not expose a vulnerable population to higher risk at this time, and I think it's everybody's responsibility to think differently about this disease.
So thank you so much for everyone who has joined us, and Dr. Ajay Kumar from the Hartford Healthcare System. We're also going to be breaking this down for you tonight on Eyewitness News starting at 4:30. We'll take some of the most important points the doctor has made and bring it to you there. I encourage you to share this in your feed. It's been pretty comprehensive. You've answered everything. So at least at this moment, on this day, I know things are changing, but this is the latest information we have right now so hopefully people can feel a little bit more empowered.
Thank you. Thank you.
Thank you.